Combined HIV TB testing, care curbing infection and mortality in Niger. 6 months ago I went for checkup. I thought it was something simple like flu, but my illness was much more serious, says Ali, 47, from Talladje district of Niger's capital Niamey. I was diagnosed with tuberculosis and HIV. Tuberculosis, TB, is one of the world's deadliest infectious diseases, taking the lives of about 1.5 million people annually. It is also the leading cause of death among people living with HIV, PLHIV. In Niger, tuberculosis prevalence among PLHIV was estimated at nearly 4% in 2019, with a 21% death rate, according to National Tuberculosis Control Programme, PNLT, statistics. World Health Organization, WHO, estimates that PLHIV are at 20 to 35 times higher risk for developing TB. To address this TB-HIV co-infection threat, WHO recommends, among other measures, that dual care is provided at one-stop units within health facilities. This approach reduces delays in initiating antiretroviral treatment, ARV, improves prognosis, limits the need to visit several facilities to receive care, and curbs treatment dropout rates. In 2020, with support from WHO, Niger launched a pilot program to establish the first 65 one-stop units. The organization also helped mobilize partners such as the Global Fund to fight AIDS, tuberculosis, and malaria to finance the expansion of this initiative. With financial support from the Global Fund, nearly 197 terabyte screening and treatment centers have since been transformed into one-stop units for the management of TB-HIV co-infection. By the end of 2023, Niger had one-stop TB-HIV units in 262 of all its 291 testing and treatment centers. This has really helped improve our impact. We recorded a 50% increase in the proportion of TB-HIV co-infected patients who were screened and treated between 2020 and 2022. We have significantly reduced delays in patients starting ARV treatment, says Dr. Omar Safi, TB/HIV focal point at the National Tuberculosis Control Programme. Within 3 years of implementing the strategy, almost 90% of health centers have been transformed into one-stop units and are fully operational. Treatment of TB-HIV co-infection has risen from 3% to 89%, and mortality rates have decreased from 21% in 2019 to 14% in 2022. Together, WHO and the Global Fund have supported the training of more than 400 health workers in HIV counseling techniques, testing and dispensing of ARVs. Mariama Isufu, who heads the Talladje Health Center, was among those who benefited from the training in February 2023. In the past, we didn't take on HIV cases due to lack of skills and resources. Now, we take care of TB-HIV co-infection, she explains. In the 7 months since the implementation of the one-stop units approach, the Talladje Health Center has registered 82 terabytes patients, 3 of whom tested positive for HIV, and began ARV treatment. With this new approach, we can take care of people with HIV. Before, we referred them to ARV prescribing centers. Now we take care of them directly, free of charge. There's also the added benefit of privacy and ease of access. Isufu says, Niger does not intend to stop there. We hope to further reduce the mortality rate to the accepted 5%, says Dr. Mariama Baisa, TB-HIV program manager at the WHO country office in Niger. The country also plans to mobilize additional resources to accelerate its response to this dual health threat. Awareness raising, access to quality care and regular patient follow-up remain essential pillars in preventing the spread of TB-HIV co-infection and improving overall health in Niger. After testing positive for TB and HIV, I'm receiving care right here in the health center. My follow-ups are conducted by the head of the center, who gave me a nice welcome. I receive all the medicines free of charge, Ali says. Since I started treatment 6 months ago, my health has improved a lot. I no longer have any symptoms. I eat normally and I feel great.